Hi, everyone. Welcome back to Basement to Bedside, AAMI's HTM podcast. I'm Danielle McGeary, and I'm here today with Robert Burrows.
Hi, Danielle. How are you?
Hi, welcome back.
Good to be back in the studio with
Yes.
you. Episode 2 here of Basement to Bedside.
Yes, we didn't get canceled, so that's a good sign.
That's good. Well, I think I'd have to cancel us. We're not going to do that.
Yes, that's
I
true.
think that'd be, or Pamela might cancel,
Yes,
but so
yes.
far we're doing okay, I think. So, well, we've got a ton to get through. This is the second episode. We had a lot in the first episode, but I think we
Yes.
have even more in this one. And shout out to producer Dan and director Darren. They have us well prepared. So I have
Yes.
a huge packet to get through with
Yes.
you. And we have some exciting guests in the studio today.
Yes, we have Hank and Kenny from Sigma Consulting, and they're going to be talking about the Joint Commission crosswalk with all the new requirements.
All right.
Yes.
There's a lot of meat on the bone there. So that means we have to get through all the fun stuff and get them in
Absolutely.
here. All right. So we're going to start with, what are we calling this? Where on earth is Danielle McGeary? There's some kind of where have you been? You're all over the place all the time. I don't know what we call the segment, but we're going to talk about all the cool people you've visited.
Yes, yes. And to date, I've taken 32 flights and have flown about 32,000 miles.
Wow.
All domestic.
All
so
domestic. Yeah. You
Haven't
don't
beat you. I
stack
think
it.
you did one trip and did that, right?
Yeah. It's a long way going around the world, that's for sure. All right, so let's talk about, we got this great packet Dan put together for us. Let's talk about some of the places you've been. So it looks like you started out the Clinical Engineering Association of Illinois.
Yes, I was the keynote speaker there. It was a fabulous event. They always put on a really great show.
And then you did HTMA Midwest, and I think we're going to have pictures up of these, so that's cool.
Yes, I was the
HTMA
keynote
Midwest.
speaker there as well.
Were you the keynote speaker everywhere? Is that
No,
actually-
no.
Not always?
No,
Okay,
not
I didn't know if
always.
you were going to say
It's
that for
always
everyone.
there. I mean, I can't keynote speak everywhere every
Sure you
year.
can. What's wrong with people? All right, fine. All right, and then let's see, Indiana Biomed.
Yep, I keynoted there as well.
All right.
Yeah,
And then in your backyard, right?
yes,
The
we
VA
went to the VA
trip.
in Bedford, Massachusetts, which for people aren't familiar with the area, it's about 10 miles north of Boston.
Okay.
We're doing a project with Ambify with the VA where we record preventative maintenance videos where it walks them through step by step. And us and this whole film team went up and we wanted to really have high quality videos for those PM procedures. So
Right. And that's
there we
Vision
are.
1, right?
That's
Am I getting
Vision
that right?
1, which
All
is
right,
New
so shout out
England.
to the folks
Yes,
at
it's
Vision 1. And Ambify is an incredible
Yeah.
pilot we're doing with them. And if people don't know about that, they should reach out to you and find out what we're doing there because it's
Absolutely. We
really
wanna
incredible.
Scale it.
All right, I got to flip through my packet here. We had the HTMA Collaborative Webinar Kickoff. What's that about?
So this was a really exciting project. So for folks that aren't aware, we meet monthly with all of the HTM leaders across the country. And what we want to do is solve their problems and challenges. And one challenge they brought forward is obviously there are parts of the country that don't have an HTM association.
Right.
And even areas like New England that do, if we have a meeting in Southern Connecticut, the people at the tip of like Orono, Maine aren't going to come down and drive
Right.
5 hours. So there are areas geographically covered by HTM associations, but they might not always have access to education. And that's really important when it comes to maintaining your certification.
Yep.
So what we did was we started a monthly webinar series called the HTM Collaborative Webinar Series. And
Okay.
it happens monthly. And an association takes the lead every month.
And
So
that's what I like about it. It's the community doing
doing
the work, to
finding-
serve the community,
to serve
right?
the community. Yeah,
Yeah.
absolutely. So they find the speakers, but Amy does all the back end work. We set up the the registration, we run the webinar.
Right.
And Ryan Gonzalez from the HTMA Ohio, he's really taken the lead on this. And he
Fantastic.
has just been such a phenomenal volunteer in person to work with. And I also was at the HTMA Ohio event as well and ran a women's panel there. Also a really great event. I didn't get a picture there, unfortunately, but I
Alright.
was there.
We
and
believe
I just want
you.
to give him a shout
We
out
believe
because
you.
I love people that really just volunteer for the better good.
Oh, that's
So-
awesome. All right, so we got a bunch more to get through here.
Yeah.
Let's see. You did. You went down to Fort Sam Houston, the schoolhouse HTM week down there.
Yep. And I visited the College of Biomedical Equipment Technology when I was there. And I also stopped by Sturdy Hospital up in Attleboro, Massachusetts when I got back home to be part of their HTM week celebration as well. So.
All right, and you got a great picture there at both the schoolhouse and at CBET. Shout out to them. We do a lot of great work with
Yes.
these guys. We really appreciate it. Virginia Biomed, home state here. So there you go. And I
The
think that
keynoted
was
there was the
out in the
keynote.
mountains somewhere,
It
right?
was out in Wintergreen. It was
Wintergreen,
beautiful. They've
place.
done it quite a few times there. It's a beautiful facility.
That's
there.
definitely a good one. Let's see. And then meetings here at the AAMI office, the CBET and CRES job task analysis. So we're redoing those certifications, right?
Yep. So what we do, so most people have the false claim that we haven't updated our certifications in years.
Who says that?
Oh, a lot of people.
Call me.
I know.
That's not
So
true.
every 5 to 7 years, we do this exercise. So the test is refreshed every 5 to 7 years. And what we do as part of the job task analysis is we look at the tasks of the job, basically, of a BMET or an imaging engineer. And we go through and say, are these still the current tasks today? And if they are, maybe they're not. And then from there, and sometimes it's just reweighting the question. So this year we put a higher emphasis on cybersecurity and did less of the electronics math.
Right.
Because we're not doing math for day to day in that way. You need to understand the theory. But and then what we do is we rewrite the questions based on how the job task analysis.
And when is that new exam hitting the streets?
It just hit this past November. So they just tested with a brand new test this year.
All right, very good. All right, so I'm going to get through a few more here. We did, you did the Georgia Biomed Association and the North Carolina Biomed.
I did not keynote at North Carolina.
Come on, North Carolina.
I did a couple years ago though, so I have been the keynote speaker there.
Good. We love North Carolina.
We do.
All right, so the Dental Fix conference, that's something we did together.
Yes.
Very exciting. You want to tell people what we're doing there?
Absolutely. So I think we'll talk a little bit about this when we get to the exchange segment of our show. But as you know, we've acquired the Dental Fix conference, and it'll now be part of AAMI Exchange going forward.
Woo-hoo. That's going to be fantastic because dental care is healthcare.
It's healthcare. Right? And we hosted an event at the NASCAR Hall of Fame down in Charlotte to celebrate. Now,
I don't know what this is the final one. I'm not sure where in the country this is. The New England Society of, are there clinical engineers in New England?
There are. There happens to be a lot of them.
Yeah. And where do they come from?
UConn.
Yeah.
Go
Huskies.
Huskies.
The chance to do the plug. I had to. So, all right. So you did a lot of miles, a lot of time on the road, and I'm sure next year will be just as full, just as busy.
It will. And I try to alternate every other year. So the events that I went to this year, I may not go to next year. I'll go to the other ones that I missed. I try to be fair and cover them all.
Well, if you want to meet Danielle McGeary in person, that schedule's always out there, right?
Yes.
And you can go meet her in person at one of these great events. And we do encourage people to get involved with their local association.
Absolutely.
It's a
they are
way to strengthen the field. Yeah, absolutely.
A lot nationally, and we try to help everyone nationally, but I feel like a lot of the camaraderie and learning and where you make those relationships as someone who's been in the field happens locally. I mean, I can't tell you how many relationships
and because of the HTMA, that gets them to AAMI too.
Exactly.
So it's you can get both with sort of one engagement. All right. So now we're gonna and we were gonna talk a little bit, but I used up so much time going through that about some of the big sort of high. So give me the top three. What are the top three issues here about rapid fire?
Top three certification always.
Okay, good.
Sometimes about cybersecurity.
Cyber.
And AI, of course.
AI.
That's a hot topic.
All right, AI. We talked a little bit about that for sure. All right, so that brings us to this is a year in review, right? So we kind of went through and looked at some of the articles that we thought were really impactful.
Yes.
And you picked, I don't get a vote. I don't know why you guys don't let me vote, but you guys picked the article about what it takes to build a long-term equipment plan. So this was, let's see, SME citing the piece included Paul Kelly, Samantha Harold, Carol Davis Smith, Sam Jocks. And it was a really well-read article. What was the issue this article was addressing?
Yeah, so before, I just want to say it's a 24/7 article. So the top hits of the year are from our HTM newsletter. If people aren't a member, they need to sign up and get it.
Shout out to 24/7.
We have our articles, but we also do other articles from TechNation, 24/7, .med, just other periodicals out there. So what we did was we looked at the most clicks, not just AAMI clicks.
Oh, so you didn't just pick this. This won.
No, this
is
was
like
voted on by the community. It was democratized.
Clicks are your votes. Yeah, well, that's fantastic. So what was the issue it was designed to address or written to address?
So I think capital planning holistically, right? That there needs to be a centralized way to capital plan in hospitals and to have a multi-year equipment plan for strategic capital replacement.
Right.
So as clinical engineers, this is near and dear to our heart.
Right.
And really, when you can show operational efficiencies and cost savings, it's really the right outcome that we want.
And is it not always a centralized process? I mean,
no. So, I mean, when you get to smaller hospitals or even maybe some larger departments, people don't have the time or the resources to do it, or they might just not really understand how important this is.
right.
We've all worked places where you've seen duplicative contracts, right? Where HTM holds a contract, but then radiology had a warranty or a contract we didn't know about. That really is a bottleneck. It costs the hospital more money. There's no continuity of service. People may be servicing things that we're not aware of.
Right.
So, when you think about this, if you can get down to a centralized process, you eliminate that duplicity, right? You can also start to standardize.
Right.
So standardization is really, really important when we think of this, because you think about now everything is an integrated medical device.
Right.
You aren't integrating an antiquated device with a different system. It's all standardized how you do it. When you think of cybersecurity and patching, you have standardization there.
Right.
From a materials management standpoint, you're not stocking, all these different parts in the disposable accessories. It also improves patient safety.
Right.
You don't want to have multiple defibrillators. You want to, because you could have the wrong pads that go with the wrong defibrillator, and then you could end up with a sentinel event.
And every system variability and complexity introduce the potential for risk. Obviously.
So training, I'm glad you said that, right? So when we're training nursing or clinicians how to use the devices,
right.
And then also just contract negotiation for service.
Right.
If we say, hey, we're going to standardize, 90% of our fleet to, this type of anesthesia machine, lock-in pricing for us for the next 3 years. We can't replace them all this year, but we'll do a rollout and do them sequentially over these years. You have much more bigger negotiation power. So it improves patient safety, it streamlines the process, and it saves the hospital money.
So the article kind of lays out all of these arguments and some of the steps required to do this. You mentioned me when we were talking about this, the power of no being an important concept. What's that about?
Yeah, so Samantha Harold mentioned this in the article, and I think it's a fabulous, fabulous point. So when you have this multi-year capital plan going, instead of just doing ad hocs, the squeaky wheel or the doctor that talks the loudest saying, I need this now. If you have a plan that clearly lays out how you're going to do this over the next 5 years, you have a reason why.
Right.
So when someone says, I want my CAT scan replaced this year, you can say, well, we're not replacing it this year, but it's on year 2 of our strategic capital replacement plan.
Right.
So it really changes that no and how you deliver no, because you're not really saying no, you're just saying not now, and you have data to back it up, which it really—
Stick to the plan.
Yeah, stick to the plan.
That's the answer. Yeah,
it should be reevaluated every year, right? Something may go end of service, end of life. Or one thing that was also interesting in this article that came up was clinical end of life. So we often, as clinical engineers and BMETs, think so technical.
Right.
And we are the technical experts, right? But we also want to think about the clinical obsolescence. We want to be able to be the voice of the clinician, because that's who uses our equipment all day long, So a few years ago, there was a new requirement for reimbursement that came out for lung cancer screening and having to do low dose CAT scans. And while many of these CAT scans were not end of life or end of service, and you could still keep them alive with replacement parts, they were clinically obsolete.
Right.
So if the hospital wanted that reimbursement, they couldn't do those procedures because they didn't offer that low dosing.
Right.
So you would have to replace it for clinical obsolescence. And I think as HTM professionals, we need to be working with the clinicians. We need to be in those multidisciplinary groups. We need to be at the capital committee table. I mean, that's step 1. If you're not, you need to get there. And just really look at it holistically and centralized. And you can really solve a lot of problems by working together and being that voice and being that point of standardization for capital planning.
So the article lays all of these arguments out and will help folks understand how to get at that table as you're speaking about. And they can find that article on the AAMI website, or it's available on 24/7.
Yep.
Most importantly, they need to subscribe to the newsletter.
Yes, the HTM
Because if you want great
newsletter.
articles like this in your inbox every week, as you said, it's not only AAMI news, it's also a collection of news from around the internet.
Yeah, it's HTM news in general. So
Good stuff. Good stuff. All right. So one final thing we want to talk about before we bring our guests in.
Yes.
AAMI Exchange.
Yes. I can't believe it's coming up in May. It's early this year.
I know. It's actually, let's see, I've got it here, May 29th to June 1st in beautiful Denver, Colorado. So
Mile high.
we went from New Orleans
Yeah.
to Denver. That's a pretty big
Yes.
pretty big climate change. And I think most folks know, this is 2,000 plus attendees, all focused on HTM, huge expo floor, more than 70 training sessions, all those kinds of things. And this year, the Dental Pavillion,
Yeah.
where we folded Dental Fix into AAMI Exchange, and there's going to be a stage within the Dental
Maybe a
Pavillion,
stage
so some
presentation.
training there. And we're really just trying to drive that cross-pollination between these two related parts of healthcare, right? And you've mentioned to me many times dental is a part of these integrated health delivery networks, especially at the VA.
Yes.
And so it just makes sense that we bring those things together. We're delighted to be partnered with Uptime Health as a sponsor of that.
Yes.
They ran the conference, obviously, up till now, and now they're the sponsor.
Of the pavilion,
It's going to be very exciting. So if people haven't registered yet, when registration opens, they're going to need to get registered and come see us in Denver.
Absolutely. Registration will open in January. So,
all right. So
and I can tell you that the list of presentations, we got over 300 abstracts.
Wow.
We can only take about 60. But these abstracts,
So
I
you
got
got
to
to pick
review
the
them.
cream of the crop.
They are the cream of the crop.
Good.
Deep subject matter expertise. And it's really what I love is the science, like in the engineering mindset behind it.
Good.
So it's good. You want to be there and
Very
you get
good.
your CEUs as well.
There
Take your
you go.
certification.
There you go. That's it. All right. So let's switch now to our guests. And we've got Kenny Colavito and Hank Stankiewicz coming in to join us.
Yes.
And I don't know how we're doing that. Are they just walking in here?
I think they
Are we
might.
bringing them in?
Yeah, they're going to come on in.
Do we ring a bell? What do we do?
Maybe, I don't know. Spotlight
Darren?
or something.
Darren? Let's send in the guest. All right. And what we're going to be talking about as we get them in here is their new Accreditation 360 program, right?
Yep. It's their new effort to really update their standards in 2026. So
All right.
they're going to be talking about a crosswalk looking at the old and new standards. And one thing that I think is really interesting about this is, we've always been conditioned as HTM professionals that we're surveyed under the environment of care chapter. And what they've done is they've combined the environment of care chapter with the life safety chapter. And now they're calling it the physical environment.
All right.
So
well, actually, what we can do is take a short break. We'll get them in here.
Absolutely.
And we'll continue from there. So we'll be right back.
Hey, everybody. This is Janesh Patel from Uptime Health. I'm here to talk to you about the Uptime Services and Dental Fix Summit for 2026. If you joined us this year in 2025, you know that we recently partnered up with AAMI, the Association for the Advancement of Medical Instrumentation, to host our next year's summit in Denver, Colorado, alongside their AAMI Exchange, which is their biggest annual summit of the year. We're extremely excited about this partnership for a variety of reasons. One is this association is the HTM, or the Healthcare Technology Management Community's thriving lifeblood. They are always advocating for the service industry and making sure equipment is always healthy and maintained to its highest standards in any care environment. They see what we see, is that medical and dental are integrating in the future, and it's happening right now as well. And the more we can put dental and medical service professionals together, learning under the same umbrella, networking, communicating, and just evangelizing for each other. That's what this is about. By joining forces and creating the Dental Pavillion, the first time ever in AAMI's history, shows that we are taking step forwards to meeting the market where it's going. I can't wait to see you in Denver. I'm looking forward to seeing you at the AAMI Exchange. If you were a sponsor at one of our earlier summits, you're going to be blown away by this, and I highly recommend you get a booth or sponsorship for the AAMI Exchange. There's still some available. Also, when it comes to the attendees, they're already opening up their registration for early attendees for the AAMI Exchange. If you remember what we do, we used to put this stuff out there a few months in advance of our summit. These guys are professionals. This stuff is well planned in advance, and you're already welcome to join. If you have any questions, reach out to me or the AAMI team. I'm looking forward to seeing you in Denver.
All right, and so we are back, and you will notice that I'm in a different chair, which is why it took a moment to get our guest in. That's my faux pas. Sorry, guys. Glad to have you here. And if you would, just take a moment and introduce yourself, please.
Good morning, Robert and Danielle. I'm Hank Stankiewicz. I work for Sigma Health Consulting. Worked for 37 years with the VA, and now 13 years with Sigma. And it's been a
Can't believe
great
it's been
journey.
13 years. My
I know.
goodness.
With the retirement didn't work.
I know.
I was retired for 1 year, and my wife said, "You got to find something to do."
Get out of the house.
And
Yeah.
Kenny and the crew were kind enough to hire me and continue to get to work with the VA.
Fantastic.
And,
I love it.
And Hank was my mentor at VA because Hank was the service chief of VA Boston, and
That's
I
right.
later held that position. So
She did okay.
Yeah,
I mean,
she
she's
did-
still here.
she did
She's
very
still in the
good. Yeah, no,
profession.
she did good.
All right.
The Boston healthcare system where Danielle worked was a tough hospital because she had 3 different campuses.
5.
5, that's right. When I had it, it was only 3 major campuses, Robert.
Another
so it
10
was
years,
tough.
it'll be 12 she had, or the number will just keep
that's-
growing.
Yeah.
That's
I
where
just
you'll get
keep
into
adding
that
hospitals.
regional approach that we have with
Yeah.
with all the New England states.
Right. Well, I'm glad you're here, most of all, because I can now verify all of her stories.
Oh,
so you and I
yes.
need
I'm
time
hoping you'll have
together.
time for lunch.
Fantastic. And would you introduce yourself?
Yeah, I'm Kenny Colavito with Sigma Health Consulting. So happy to be here. So thank you to
Delighted to have
Robert
you.
and Danielle for having us and to the whole AAMI team. And excited to talk a little bit more about what we do and some of the projects we've been working on.
Fantastic. We'll say a bit about that, and then let's get in a little bit to the, and I want to get the title right,
Accreditation
Accreditation 360. Yeah.
Yeah.
So, but tell us a little bit about what you guys do.
Sure, absolutely. Yeah, we're Sigma Health Consulting is a science, technology, management advisory company. We've been working in the HTM space for over a decade, and focused predominantly working with the VA on patient safety initiatives, cybersecurity initiatives, regulatory initiatives like what we're going to talk about with Accreditation 360. And our work is pretty wide-ranging in those spaces. In patient safety, we do alert and recall management with medical devices, processing 2,500 of those a year, which is just a huge volume that we're proud to provide efficiencies centrally for the 170 or so VA medical centers. And a lot of the work that Hank does in the patient safety space, leading incident investigations, to reduce risk, find the root cause of incidents that may occur, and eliminate risks or reduce risks as much as we can at those facilities and across the network.
Fantastic. Well, we should talk more about that in follow-up. We've deepening our relationship with Ashram. And I think they're actually going to do a presentation at Exchange.
They
we
are.
working
They
on that?
will be presenting at Exchange.
Yeah. So we're trying to build that bridge between the risk management side of the house and the HTM side of the house. So you guys could really help us with that. So that's fantastic. Great. Okay, so let's jump into Accreditation 360. First of all, what is Accreditation 360?
Yeah, so the Joint Commission, or I should say Joint Commission, which Joint Commission is rebranding itself, dropping the in front of the Joint Commission.
The is going away.
Okay.
I'll do my best to abide by that change.
So wait, are they just JC now?
Apparently.
I
Yeah.
believe so.
Okay, so no more TJ. Okay, got it. No more the. All right. So what's
things
the
you
initiative?
Yeah. So along with the name, they're revamping their standards. And this initiative is called Accreditation 360.
Okay.
And it comes with some significant change and more offerings of engagement and resources from Joint Commission to healthcare organizations. But the changes that we feel like are most relevant to healthcare technology management audiences are a reduction in standards by 700 standards, so pretty significant reduction in standards. And Joint Commission has communicated that this is to reduce redundancy, to streamline, but maintain sharp standards as well. And some of the specific changes are, I heard Danielle allude to them earlier, in combining the life safety and environment of care chapters into the physical environment chapter. So that's a new change. They've also introduced a broader goal structure. So instead of national patient safety goals, it's national performance goals. So a little bit of broadening there, which do still include patient safety aspects, of course, but a little bit broader, including staffing and other topics there. And then revision of their survey process guide, which is a newer document replacing the survey activity guide. And the survey process guide, or SPG, is a really robust 600-page document that is what it sounds like, the guide for the surveyors. So offering some transparency into that process to organizations to follow along in what the surveyors will be checking for.
And I really like that because I don't know how many people watching have seen the activity guide, but we probably have all seen it. And it's kind of like, like when you study for the SAT, you kind of get like this rubric of what may be there, kind of what might be going on. And I really like that the survey process guide really brings that level of transparency so you know exactly what that benchmark is. And I'm excited to have you guys kind of break that down a little bit more so you can kind of look at, how this changes, because I think those of us who have been in the field for quite a while, you're so used to hearing the environment of care, national patient safety goals. Like that's what you live by, right? That's what you measure against. So even this change in the nuances in how what we're calling these new things is a major change for the field. And we're going to have to adapt and kind of get used to that as well. So do you kind of want, so from my understanding that they're still focusing on quality and safety, but I think what the HTM professionals are dying to know is, how does this affect them? Obviously, we're changing, what we're calling things, but let's get to the meat and the bones of it. So do you guys want to kind of talk about that to some degree?
Yeah, absolutely. And again, from the Joint Commission, they've assured our community, if you're compliant in 2025, and these changes for Accreditation 360 go into effect the first day of January 2026.
Okay.
So soon. Joint Commission has assured the community that expectations aren't changing, that they're reducing burden, streamlining, reducing redundancy with Accreditation 360, but the expectations remain the same. So if you're compliant in 2025, you should expect to be compliant in 2026. So in our work, we've identified through all the resources that Joint Commission has published around Accreditation 360 and talking with AAMI and our colleagues at the VA, that we can use a HTM-centric resource or resources to help guide our colleagues through this process. And working with Megan Friel and the director of HTM at the VA and her deputy, Michelle Baque, and director of operations of HTM, Jordan Anderson, identified this need and have worked closely with our colleagues at VA to develop some resources. So what we did is we looked at all of the current or soon to be legacy requirements and identified those that are relevant to HTM, and identified 75 plus, close to 80 standards that we feel are relevant to HTM, and looked at how Joint Commission has described the changes to those standards. Some of them have been modified, some of them have been moved, some of them have been pushed into the survey process guide. So we did a crosswalk of that information and identified the specific new standards that apply. And in the survey process guide, our colleague Kelsey Patel did yeoman's work looking through 620 plus pages of that survey process guide to identify the references that are applicable. So that's a resource that we've worked with the VA to provide the VA HTM community. And then also a more robust version that has the actual language pulled out, not just the references, but the language too. So we're providing an HTM-specific resource that's distilling these very robust resources that the Joint Commission has provided, so to reduce some of that burden even further for our community. And it's just for us. And in doing all of that, we've been able to validate that what the Joint Commission is communicating is true, that there aren't new expectations. where we've been able to successfully trace all of the previous standards to new documentation and accreditation 360.
So they're just aligned differently. So Hank, what's your take on all of
that's
this?
what I was going to say, Danielle. You asked the right question. How does it affect me as a working biomed in the field? And it gives us, I think, a little more work once we read through it. But then, as Kenny says, it really is simplified. But the message that we have to give to leadership is that the standard information is still there. The requirements for the medical equipment management plan is still there. For PM testing is still there. For radiological work is still there, but it's organized differently. So it doesn't jump out at us like it did in the environment of care, Danielle. So you have to look at those performance goals to make sure that upper level management understands that medical equipment management is still critical to the success of good patient care as well as the accreditation process. And that the crosswalk that Kelsey Patel, who works with us, did with Mike from Connecticut and other VA person, it's terrific because it shows, okay, this is where the PM requirements are now. It's still there, it's just in a different section.
So is this, I'm sorry.
Oh, no.
Is it an advantage? We were talking about capital equipment planning earlier and making sure that folks in clinical engineering and HTM have a seat at the table in that. The fact that these streamlined guidance documents sort of integrate that into a larger framework rather than calling it out specifically as a separate thing, is that a good or a bad thing?
Well,
does that give HTM a more direct path to being at the table, or does it become a little more challenging because it's not explicitly labeled?
That's a very insightful question, Robert, frankly, because initially when Matt Baratek presented it at a conference up in New England with Nesky, our local conference up in the New England area, it said that the fear is that all our standards are buried now. But I think something that Kenny was saying is, and what you just said is, really integrates us more into the hospital.
Right.
That we're part of that hospital function and having a seat at that executive table.
Right.
And at some point, if we can work in your equipment planning is just spot on. And this, biomed can't succeed in its service management role if we're not involved in that equipment planning. And I think part of this 360 is to have the hospitals understand that biomed is integrated into the flow of healthcare technology and healthcare delivery.
Right.
The path to the patient.
Yes, and here at AAMI, it's not just about the patient monitor, it's about the implantables and everything, where biomed still impacts and can help the physicians and the clinicians.
Yeah. So it could be an integrated environment now that would benefit.
Absolutely.
The field.
No, I think that's a great spin, Robert. I really do.
I'm good at spin.
You
that's
did
what
great.
I do.
No, that's no, because some of us are fearful of that. It was expressed at the Nesky conference, frankly.
Right.
That what we don't have this one standard that we can look at.
Right.
But it's integrated in the healthcare flow.
Right.
And as Kenny said, the survey process and the tracer methodology is still going to be there.
Right.
And I think it really speaks to the field, right? We have an aging workforce. We've been around a long time. And I think whenever there's change, there's always apprehension and fear that comes along with it. And I think it's really just changing your perspective, thinking differently, using it to your advantage to say we are part of that physical environment. And that's everything that touches the patient and the clinician. And I'm really glad you both are here today to really break this down, because I think the key takeaway is keep doing what you're doing.
Yes.
And I don't know if you guys have any final thoughts or anything about it.
Yeah, and I wanted to just recap, because we've talked about a lot, and we've got the backgrounder you guys were kind enough to provide. So the key takeaways for folks are reduction of more than 700 requirements. We talked about that. Introduction of the national performance goals, right? So a little change in language there. Formation of the physical environment chapter, which consolidates the environment of care and life safety, and then revision of the survey process guide. And it sounds like that's, to me, as I was listening to this, and of course I'm a lay person, but the survey process guide, I think that's a great leap forward, actually. In my background, it was always funny when people would say, don't teach to the test in different environments. And I always thought, why wouldn't we? If we want people to know what they're required to do and how to meet those requirements and all that, why wouldn't we be very explicit, very clear about that? And it sounds like that's what the new survey process guide does. Am I hearing that right?
I think, you're hearing it right. That's where we're hopeful.
Yeah.
we'll know in January how well
how it's applied.
Yes.
Yeah, absolutely.
So maybe
Yeah.
at AAMI Exchange, we'll have to have you guys back in the booth on Live at AAMI Exchange, and we
Interesting,
can
sure.
talk
Oh,
about
that's
your
right. We'll have some
update
field
Yeah.
time
as
with this.
with the
Yeah.
field time. Will you guys accept that invitation? Will you come talk to Robert and me again?
Wow, you're really
Absolutely.
putting them on
Wow,
the
really?
spot.
I know.
Are they going to say no to our
Yeah, right. It's hard to say no.
Well, I guess
it's hard
we'll
to say no
know.
to Danielle.
It's always hard to say no to
But no,
Danielle.
but Danielle, you're right, because Kenny's worked it out with the VA and with Megan and Michelle and the whole team there. That let us, who's next, who's getting surveyed in January, who's getting surveyed in February, so that we can learn and modify what we've written and what we can give to the VA for guidance.
Yeah, absolutely.
And we're working also with the private sector folks.
Yeah.
Danielle and I are from the Boston area, so when is Mass General Brigham getting surveyed? When is Children's Hospital Boston getting surveyed? What feedback can we get from that? Not just being myopic, working just with the VA.
Yeah.
But we need to bring in all of our colleagues.
Yeah, so should that be a call to action? We should actually, it sounds like we're encouraging folks to reach out and share their experiences.
Absolutely. We want to hear. We want to hear what are your challenges?
Yeah.
What are you seeing? Because again, it's not always one size fits all. And
Yeah.
and I think we've battled this, throughout our careers that, the survey is only the same as the surveyor.
Yes.
Right, the interpretation of the rule,
Yes.
how you're cited. So I think we can see some variance, and when there's change, there's always going to be some kinks as we work through it. So I think it's very important for the field to let Amy know, and we can let you guys know what we're seeing out there.
Yep.
And all joking aside, I joke about spin, but I applaud this. It looks like a step forward. Clarity is always better than a lack of clarity,
Absolutely.
and Joint Commission's really invested a tremendous amount of effort into streamlining this process, making it more effective. And so we sort of applaud the effort and thank you guys for everything you're doing to translate that for the field. And of course, our friends at VA and all the folks you mentioned are
Yes.
good AAMI friends. So we know really good people are working on this.
Yes, and thank you for coming to the AAMI headquarters today as well.
And this is our Virginia equivalent of a snowstorm, just so you know. All this
I know we're
brouhaha
also
about-
nervous about flying
Yeah.
home, but
I
it's
know.
Yeah.
it's very wet for snow.
Yeah. We don't.
Yeah.
Our snow is not the same as your snow. We had about a millimeter of ice on the trees this morning, and it was the end of the world. So, well, listen, thank you very much. So, I forgot my call to action. We're supposed to sign off, but I don't even know.
We
what it
are.
was.
So, you can find our show on Amy's
There you
YouTube,
go. Thank
Spotify,
you.
Apple Podcast, or wherever you get your podcasts from. So, thank you guys for tuning in today, and we will see you back in March.
Absolutely. And then at AAMI Exchange in Denver. And don't forget to sign up for the HTM newsletter. And we'll keep the good information about this and all the other things going on in HTM coming.
Yes.
So, all
We'll
right.
see you guys
Thank you,
soon.
gentlemen,
Thank
for
you
being
very
here.
much for having
Safe
us.
travels. Be well.